enjoy your hour with this group. And I'm going to turn it on over to Lily.
Thank you, Kim. All right, I will just share my screen and we can get going. Oh, wait, do I know what I'm doing? Maybe. All right. Hello, everyone, and welcome to our presentation. My name is Lily Griman. I use she, hers pronouns. We'll have a moment on the next slide to do some more deep introductions, but welcome to Home Usability to Support Community Living, next results and next steps from the Pickle Project. And then we have a quote here from a consumer participant. It's life-changing about the project, which is great. And then on the screen, there's a graphic. It's the Home Usability logo. It's two houses, one yellow, one red, next to each other on a patch of grass, kind of cartoon houses. Oh, yeah. So really quick, we'll do a little introductions and workshop overview. So this is a presentation brought to you by the Research and Training Center on Disability in Rural Communities and the Ability Center. And the Research and Training Center, it's actually Research and Training Center on Promoting Interventions for Community Living. And I work at the Research and Training Center on Disability in Rural Communities. So that's too many RTCs for me to keep track of. So apologies there. The RTC Pickle logo is in the bottom left corner in blue and maroon. And then we also have the Ability Center logo there in yellow. So again, my name is Lily Griman. I work for both the Research and Training Center on Disability in Rural Communities and the Research and Training Center on Promoting Interventions for Community Living. I'm a white woman in my mid-30s, wearing a turquoise shirt. I'm wearing glasses, and then I'm in my home office with a map of the world on the wall behind me, and actually world earrings as well, because I'm a geographer. I'm going to pause and turn my camera off and bring Sarah on to introduce herself, and then Sarah, you can bring Becky on too.
Well, good afternoon, everyone. I am Sarah Heltman. I work at the Ability Center, which is a center for independent living in Northwest Ohio, more specifically Toledo, Ohio. So geographically, we are about an hour south of Detroit and 4 or 5 hours east of Chicago. But I am the Independent Living Services Manager here at the Ability Center. So I oversee our adult programming, as well as our assistive technology and durable medical equipment program. I also use she, her pronouns. I am also a woman in my mid to late 30s. I have just below shoulder length red hair, glasses, and I have a floral printed top on. That's kind of a mustard color. I am sitting in my office at the Ability Center, and I have a few pictures hanging on my wall in the background that are green and gold in color. And I will bring Becky Strife on so she can introduce herself as well. Oh, Becky, you're muted. Well, we're having a little difficulty understanding or hearing Becky. So this is Sarah. I'll go ahead and introduce Becky and then we'll try to troubleshoot her sound. But Becky also works at the Ability Center. She has worked here for 21 years. So Becky uses she, her pronouns. She has short blonde hair and glasses, and she is sitting in front of a mural with a bunch of words to describe the Ability Center services. Becky, her official title here is the research specialist. So she has been a part of the Promoting Interventions for Community Living project for the past couple of years. And prior to that, she helped transition individuals out of facilities and into the community. And Lily, will turn it back to you.
All right. Thank you so much, Sarah. And I hope we can get, Becky, we hope we can get your sound sorted out. But while they troubleshoot that, I will take us through a little bit of the overview of this workshop. So in this workshop, we are hoping to give you an overview background of the Pickle and Home Usability project. We'll share some evidence and results from one evaluation of this project. We're currently in the middle of another evaluation. You're going to hear some real world examples of home usability projects and some success stories from the Ability Center. And then also a little bit about how the Ability Center plans on continuing the program beyond this research. And will include some strategies and resources for funding and starting a home usability program at your CIL. Right, so really quick, let's talk about the Pickle project. Pickle stands for Promoting Interventions for Community Living. And over the course of this project, we've had a whole lot of fun with the fact that the acronym is Pickle. I probably should have incorporated more pickles into this presentation, so my apologies. This has been a collaborative project between the universities of Kansas and Montana and 6 different centers for independent living. We did this project across 2 phases. Phase 1, we partnered with Summit Independent Living in Missoula, Montana, and the Whole Person in Kansas City, Missouri. And then in phase 2, which is the phase we're currently in, we are working with the Ability Center in Toledo, Voices for Independence in Washington, Pennsylvania, Disability Link in Tucker, Georgia, shout out to Kim, Accessibility in Indianapolis, Indiana. We're going to talk a little bit about the results and some of the research findings from phase 1. And then phase 2, we'll talk about some of the current success stories that we've seen. We're still in the middle of projects, so we haven't analyzed any data yet, but we have had quite a few people go through the project and provide some really exciting feedback. So the project was really testing the efficacy of 2 different interventions. One was home usability and another was called Out and About. We're going to be focusing on home usability in this presentation. All right, moving on to slide 4. So we're talking about
Lily,
home usability. Oh, yeah.
Can you hear us on Becky's computer?
Oh, yeah, I can.
Fabulous. Sorry to interrupt.
Yay, welcome. Perfect. Well, we have a poll here, so I think I've never actually done a poll, so I'm going to have Sierra, I think, push it, but I'll read the poll questions. Great. So we're going to talk about housing programs at your CIL. So what kind of housing programs do you offer at your center? And I think this is a check all that apply. In-house home modification program, for example, your CIL provides funding. Your CIL supports consumers in home modifications, but does not provide funding. For example, funding comes from waiver services or another funding stream. Referrals for consumers to other home modification programs. Home modification or housing supports connected to transition from nursing facilities only, or I guess youth transition as well, I'll include, of course. Support consumers in finding accessible, affordable housing and community level housing or community level housing advocacy. And I didn't include a other category here, but if there are other services that you provide, please go ahead and put those in the chat and we will try to read those out, although I'm having trouble finding the chat right now in my screen share.
Okay, well, there is several votes in. Do you want to end the poll?
Yeah, and then do you push it out and share everyone to share their results?
Yeah, sure can.
Yay, awesome, woohoo, look it, great. So it looks like we have some folks on the call who do in-house home modification programs. We have kind of a variety of folks. A majority of people are supporting consumers in the community to find accessible and affordable housing, and then also supporting consumers in home modifications, but do not provide funding. And that's something that we're going to get into. Part of this project really came about of the challenges and the expenses that come along with, of course, larger home modification programs. And so we're going to talk a little bit about how this project is doesn't really serve as a replacement for a home modification, but as a complement, as a a program that you could potentially start to institute that's at a smaller scale than a large home modification program. Oh, geez. All right. And then I don't know, Sarah or Becky, are you able to see the chat at all? Because I'm struggling to see it. So I don't know why I can't find it right now.
Nope, the chat is not enabled.
Oh, okay.
There was one question asking how many attendees are here. So I did go ahead and answer that. And there's
Okay,
35 attendees and then 8 panelists.
Okay, awesome. Sarah, is there any way we can enable the chat, or do we have to stick with the question and answers then?
Yeah, people can still, so we'll have to use the question and answer. And
Okay.
so if you want to drop comments or questions in there, that is the best way to do that.
Okay, great. Yeah, so please use the question and answer for a variety. Yeah, please feel free to comment and stuff as well, because we'll want to ask, we'll want to hear from you a little bit as well later on. Wonderful. So I'm going to talk a little bit then about the home usability program. And to start, I want to talk about the difference between usability versus accessibility as we were defining these things for this project. Accessibility for this project, this is really focusing on codes and regulations, right? So rules, measurements, meeting set criteria that are maybe, more universally accessible for individuals. So outlines, things outlined such as in like the Fair Housing Act or the ADA, American Disabilities Act. Usability, in contrast, kind of meeting rules and regulations, is much more about an individual and an individual's needs in order to support them in their home. So what do you need your space to be like, regardless of accessibility? So it may be that the space for you is something that meets all of the codes and standards for something that's accessible, but you actually also may have needs that go beyond that. Or perhaps accessibility regulations don't work for you, right? That's not actually what's best for you in setting up your home. So really, usability is about you as an individual living in your home. And it's really important we think of home spaces as being such critical spaces where like intimate and personal spaces where you want to be able to engage and live in your home to the way that suits you, and not necessarily to a code or standard that is critical, but not necessarily suitable for you. Both usability and accessibility are incredibly important. The focus on this was really about usability. So what we also focused on was kind of low cost modifications, assistive technologies and support. So we had, as part of this grant funding, $350 per person to spend. And while some people either added to that fund with personal funds or found some additional funds to pay for modifications that were more expensive than that, a majority of people participating in this project kept costs at or below that $350. The project was consumer driven. We developed the program with a team of CIL staff over a few years as a different research project. And the program itself has very few limits or restrictions on how that money can be spent. Really, this project is about listening to individuals about what their needs are in their home and working to set goals and meet those needs. So our research question for this project was, does participation in a consumer-directed home usability intervention increase community participation for consumers with mobility disability? We collected outcome data. This is all from phase 1, although we are collecting the same information for phase 2. On community participation, which we defined as trips and activities in the community, levels of pain and exertion, as well as health-related variables. As you can imagine, the current iteration of this project has been collecting information on community participation during COVID has been challenging. And so we've had to kind of rethink a lot of that. However, the results that I'm going to share right initially are from phase 1, which was conducted between 2017 and 2019 before the pandemic. So people were happy to be going out and engaging in the community and not scared to. So it's a very different time, obviously. So HUP stands for Home Usability Program. The program was content was developed with a team of 5 CIL specialists from 5 different centers as part of previous funding, as I mentioned. Consumers worked closely with CIL staff to work through interventions online or with printed manuals. And as part of this project, consumers completed a home usability plan, and this included a variety of different resources and tools to do that. A home usability quiz to maybe identify where do you want to focus. We utilized some home usability self-assessments with the AARP Home Fit Guide. And then we had a variety of different tools to help people identify resources, both social, individual, personal resources to contribute to the project. So both social resources, such as family or friends who could maybe help with labor or help put together equipment. And then also financial resources if consumers had any money that they could contribute to the fund, but also identify community level financial resources. And then in the first phase, this 2017 to 2019 phase, it included a home visit by CIL staff when feasible. Most folks in the initial project were able to do a home visit, and however, that's been obviously not as possible in phase 2. So we had in phase 1 in Missoula and Kansas City, 195 consumers participate in a random controlled trial across 2 CILs. So some folks completed the home usability program, and some folks just received services as usual through the Center for Independent Living. So we had 81 participants, consumers, complete the home usability program. And I want to give a little example of some of the home usability projects that individuals completed through the program. So we have these kind of classified into different categories. So by far, most folks did, I think bathing and grooming was the largest category, although I don't want to say that exactly, I'm not sure. But bathing and grooming, so we installed grab bars, purchased shower chairs, non-slip mats. Cleaning was a really big one, so support in cleaning. So we helped purchase robot vacuums, long-handled dusters, improve storage or storage equipment, mobility devices such as walkers and canes or wheelchair equipment. General safety, fire extinguishers, medical alert devices. We supported entrancing through hand railings, video doorbells, and like smart ring doorbells and threshold ramps. Cooking, adaptive cooking equipment, sleeping new mattresses, moving. We helped a couple folks move to a more accessible space, and the project covered in those instances helped cover the cost of moving, like hiring movers. Dressing, assistive equipment to help with dressing, and then for furniture, this project has helped support folks buying lift recliners, and then also modifying desks and making a desk more accessible, usable. Assistive equipment, reacher tool, things like that. So what were the results when we got into it and finished the project and analyzed the data from phase 1? We really saw that consumer-directed home usability changes positively impacted participation in social and recreational activities. So these are the activities that folks choose to go out and do to engage with friends. We often call them discretionary activities, things that you don't have to do, but you want to do. It actually didn't make a ton of difference on what we would call trips or non-discretionary activities. So things like running errands, going to the grocery store, picking up, medication, doctor's appointments. Those are the things that you kind of find a way to do if you have to. But we really did see that making some of these changes did impact social and recreational activities. So folks were reporting an almost 40% increase in the social and recreational activities immediately following the project. However, that program, those results didn't hold super long. We did follow-up work as well, and saw that folks kind of returned back to normal. And that's where we were thinking that's a role maybe for the CIL, that it was partially also engagement and really working closely with the CIL staff that helped support some of this change in participation, as well as the home usability. And then we really did see that bathroom safety and sleeping changes seemed to have the greatest impact. So I think we have a quick question break. I see we have a question here. I do want to look at the time to make sure that we had, I think we have a little time. I see we have one question. Yeah, so here we have a question from Mitch. How can other CILs get involved in these types of projects, and how were the CILs that participated chosen to do so? That's a great question. And we actually have this project is coming to a close, and so we don't currently have any other housing projects, but I do want to refer you to the RTC Rural vendor page for other research projects that we're conducting right now. We're always looking for centers for independent living, and I don't know how we chose folks. I think it was it's been a long process. So I think the best way, if your center is interested in engaging in these research projects, is to reach out to us directly. And then we are gonna talk about at the end, I don't know if this is also what you meant, is there are ways that you can start engaging in home usability project in your CIL. And we can share materials about that. And I'm really happy to share anything with you further about that. I'll have my contact information at the end. And then I guess I'm going to answer one more question, and then we'll move on, just so we ensure that we have time. It says, what kind of interaction did you have among the other CILs? And I kind of am wondering if Kathy, you can clarify a little bit what you mean. Do you mean like in the context of the research project, how we did have, at least through this phase 2 with all the centers, we all met regularly and worked together to troubleshoot issues and engage. And I think Sarah and Becky could talk a little bit more about how we did that, maybe at the end when we have a little more time for discussion. And I do see, Susie, your question, but I'm going to hold off. And I think that's something that we can wait till the end, because I want to let Becky share some of the success stories, and Sarah talk a little bit about how this project is continuing. So I'm going to turn it over to Becky to talk about this current this current phase of the project and consumers at the Ability Center who've gone through it, and some of those success stories. So I'm disappearing now.
Hi, it's good to be with you this afternoon, and hopefully you can hear me all well now. I have 3 success stories to share with you. We had multiple stories with all of our participants, but the first one was with the 65-year-old female. She had a back injury that limited her mobility and was having trouble with safety in her bathroom. She used her home usability funds for an ADA height toilet, and her outcome quote was, "Thank you so much for the new toilet, such a blessing. I will start working on other things I need slowly, and everything will come together." So her project gave her hope for making her home usable, and not that she had to move somewhere else to be able to have safety in her bathroom. Our second success story was with the 52-year-old female with multiple sclerosis. And she also had a Ability Center service dog from out of our program, but she had great difficulty in her bathroom, being independent and not to have to ask her spouse to help her. She wanted some independence. So with this program, she used the home usability funds plus funds from other places to improve her bathroom. And with the funds she used to buy specialized grab bars, along with other items that they purchased. And her quote shows the success. The shower replacement was long overdue. As my disability progressed, washing my hair and showering became increasingly difficult. I would often need my husband to help me to exit the shower. Now I can shower without any assistance and anxiety. Participating in Pickle motivated me to address the shower safety and accessibility issues. So the program showed that even if the $350 wasn't enough to do the whole project, it with the surveys, it gave them time to think about how they could make changes in their home and increase their independence. Our third story is a 34-year-old female with cerebral palsy. She's a university student and a mother. And she identified that she had needs to increase her independence and reduce her fatigue. And she used her funds for home safety in the entryway and meal prep. And her quote emphasizes how much it assisted her. I just wanted to let you know we got the door handle installed and working fully on Sunday. It works amazingly. I also got to use the new chopper today for a recipe that would have taken me more than twice as long to prepare it in the past. It made the process so much easier and saved time and energy. And I just want to let you know how thankful I am to you and to the Ability Center for helping me with this task. The consumer went on to receive an Ability Center Auxiliary Scholarship and was featured in our annual style show and fundraiser. I believe that the program participant gave people the opportunity to have more energy, have more confidence, and reach out and obtain other things in the community that they didn't think they had the capacity to do. Sarah, I believe you're next.
Yes, thank you, Becky. So Becky gives me a great gateway to talk about how we plan to use the home usability program beyond the research project. So as the research project wraps up, we will continue to use what we've learned here at our center. So the home usability program will be a complement to the other Ability Center programs that we already have. So as a result of being part of this project, we're expanding our programs in the areas of home usability. So we're looking at our current home usability program, which we have carpenters that go out and do home usability or accessibility projects. We also have an assistive technology and durable medical equipment gifting program. And we have an internal grant application. We call it the independent living application. And that's for folks that don't have the funds to purchase things that they need to be independent. However, items are not covered by insurance or through waiver funds. We try to offer some assistance for those items that they do need to be independent. So as a result of being a part of the home usability program, we're looking at expanding those programs a bit based on the research. And then we've also started to do emergency preparedness plans with folks, and including kits to be prepared for an emergency. We've expanded our independent living application a bit. So we're going to look a little bit beyond traditional medical equipment. The food chopper is a really great example. The consumer that purchased the food chopper with her home usability funds, it was really life-changing for her and her family to be able to have more variety in food, but it's not something that we would typically think of as being a durable medical equipment or assistive technology item. It's not something that would ever be covered by insurance, but was very life-changing for her. And then we have an assistive technology lending closet that, based on the input from our pickle consumers, we've been able to look at items that we would want to consider having in that closet available for loan. So we can go to the next slide, please. So I'm going to talk a little bit about our programs. That way you can kind of see what we're doing and then how we are expanding upon them based upon the home usability program. So the Ability Center does have a robust assistive technology and medical equipment program. We gift out about 2,000 pieces of equipment over the course of a fiscal year. So we have disability related equipment that we loan or gift to individuals free of charge. The items are donated to us and we clean and sanitize them before lending them out. So we ask individuals to contact us about their specific needs. And then we also work with the community to get donations of durable medical equipment. So some common items that we give out to folks are commodes, raised toilet seats, shower chairs, transfer benches, and wheelchairs. You are all probably very familiar with the fact that insurance can be difficult to work with at times. So we kind of cut out some of that red tape for folks when they are not able to work successfully with their insurance or afford it on their own. And then slide 15, please. We also have an assistive technology program. On this slide, there's a picture of a young girl. She has dark, a little beyond the shoulder length hair. It appears that she's sitting in a wheelchair with a teal colored shirt. And she's engaging with a piece of assistive technology that's blue and has 4 white squares to select options from. So our assistive technology program is designed to temporarily equip persons with disabilities with assistive technology. The intention here is that people can borrow the items short term, either as an accommodation for trial use. Some therapy practitioners and teachers will borrow equipment for evaluation purposes or for families to make informed purchases. And then also during the pandemic, while so much of our programming has been virtual, the assistive technology closet has allowed folks to engage in our programming. So we are looking to expand this based upon the research that we found in the home usability program, where people are using virtual devices and assistive technology more regularly. Slide 16. Thank you. The home accessibility program that we have carpenters that go out and do home modification projects to ensure safety in the community and ensure safety in people's home. In Ohio, especially Northwest Ohio, we have a lack of affordable, accessible housing. So we're working to mitigate that by doing these projects. So we do projects like installing grab bars, interior and exterior handrails, low-rise steps, wooden and aluminum ramps, and also stair lifts. So we found that a lot of our pickle consumers were in need of accessibility projects. So we were able to work in collaboration with a program that we already had to continue to offer more projects. So they were able to use their pickle funds in different ways and then tap into the existing projects at the Ability Center. Slide 17. And then probably the greatest thing that Pickle did for us as a center was we really got to pause and look at how we offer adult services. So on this slide, there's an individual. He looks to be a middle-aged man with a red shirt, dark colored pants and white tennis shoes, and he is leaning on a Hemi walker. So we looked at our adult services and thought about how we were going to best support independent living goals and really looking at best practices based on the research from Pickle and how we can partner with other service agencies in our area and community organizations. So our agency identified 7 areas of opportunity that we work with other agencies on, and that we also work with individuals as we're developing independent living plans. So these areas include healthcare, housing, socialization, education, access to public spaces, which also includes recreation, transportation, and employment. So we look at those 7 areas when we're developing independent living plans with adults. Go to slide 18, please. And on this slide, you see an infographic that our agency has created. It says 7 opportunities for a disability-friendly community. And it has a pie with a different color for each slice of the pie. And it has a white graphic for each of those 7 areas, which are healthcare, socialization, education, transportation, employment, and housing. So our current projects that we have going on, we've always got some special projects. So we are wrapping up Pickle. And then our state association also, OSILC, granted us some funds for emergency preparation specific for folks with paralysis. So we developed an emergency plan based on evidence that we found with FEMA and other organizations. And then we've been able to gift folks, in addition to developing the plan, we've been able to gift them the emergency kits. And this was all kind of in collaboration with the information that we found with folks doing the home usability program and the needs that they identified. On slide 19. So something that makes the Ability Center kind of unique is we've been charged with the question of how can we make our community the most disability-friendly community in the nation? So we pride ourselves on making our entire community disability-friendly. So we say that disability-friendly is a community that values and welcomes the potential and participation of each of its citizens and visitors, including those who live differently. And we really found that using the home usability program and the Out and About program, which was part of this research project that we're not talking about today, people, when we make simple changes, that $350 has been so impactful for people to be able to engage in their community. So being able to shower independently, being able to use the restroom, being able to make a fresh meal for your family was really impactful for people to start engaging in their communities. We can go to slide 20, please. So to think about funding home usability beyond this research project, because each participant received funds while they're part of the project, we now are thinking outside the box of how can we continue offering this program in the same way, still be able to offer folks that funding. So some relationships that we've built, we built a relationship with a local furniture store for lift chairs specifically. So lift chairs tend to be kind of costly, and we were able to negotiate a discount with them. They'll actually deliver it and set it up in the person's house. We've also worked with durable medical equipment providers in our area. So if they have an overstock that they want to donate to us, or we can purchase at a discount from them. We've also done some work with hardware stores, contractors. So we work with the Habitat for Humanity restores in our area. Sometimes when they receive durable medical equipment, they will just give me a call and they will donate it to us so that it's not sitting around at their restore. And then other centers for independent living that were part of the Pickle project, they applied for the Home Depot Foundation grants, the Lowe's Home Improvement Store grants, and other local kind of hardware store related grants in their communities. We've also worked with some national and local nonprofit organizations. So for example, when we really revamped and launched our assistive technology closet, we worked with the Dana and Christopher Reeve Foundation. We received a grant from them to do so. And then we've been really fortunate to develop relationships with local thrift stores and resale stores. So we have a relationship with them at this point that we can call them and I can say, hey, I'm working with this individual. They really need some winter clothes. Winter's coming in Ohio, it gets cold. And they'll say, no problem. We'll set aside a $20, $30, $50 shopping voucher at the stores. So we looked at home usability saying, you know, maybe as a center, we can't afford to give everyone a pot of money, but we can work with community partners to do so. Some of the other centers have actually set up Amazon wish list. So they'll create a wish list on Amazon of items that their consumers are in need of. And then just through the generosity of the community and their partners, folks will purchase those items and then the center is able to connect them to the consumer. And then we also have the assistive technology loan closet, which I've already spoken about, but it has really helped people be more independent in their home as far as equipment goes. Here to slide 22, please. I think we skipped a slide maybe. Whatever the next slide is. Oh yeah, so we were just gonna ask you all, you can maybe drop it in the chat if you have innovative or non-traditional strategies that you've used in your centers to support consumers in their community living and their housing. What we found in the Toledo area is that with that lack of affordable, accessible housing, we've actually had some folks call us and say, hey, I really wanna move. I wanna move somewhere different. And then when we can kind of take a step back, well, what is it about your current place that you don't love? What can we try to problem solve through? And maybe it's something as simple as they need a shower seat. And then all of a sudden they enjoy their place that they live in because it's a little bit safer and more accessible for them. So if you want to drop in the chat, if you all have any creative ideas, we'd love to brainstorm a little bit with you all as well.
You can drop it into the Q&A. I know the chat is
I'm sorry.
That's okay. I
correct,
just wanted to
Q&A.
remind everybody. Feel free to drop into the Q&A as well.
Yeah, and I'm thinking maybe I'll just move on to the next slide with our contact information, kind of share that with everyone, and we can engage in kind of discussion and conversation through the Q&A because we do have some questions.
That's great.
Does that sound good?
That sounds perfect. I'll turn my video off, Lily, and you can guide us through that.
Okay. Thank you so much, Sarah. And I'm so happy about all of the work that the Ability Center is doing to continue this project because that can be a really challenging thing with research projects is that we're funded to conduct the research, but when that funding ends, it can be really hard to find how do we continue this work in the future. And I think some of those funding strategies, those creative funding strategies and what the Ability Center has been able to do is really exciting. And that's the thing too about this project, that they are low cost and that we really are seeing that these lower cost modifications can have a really substantial impact on people's lives. Even in just the idea of energy saving tools, right, to help provide more energy into the future. So I've got our contact info on here. You can reach me at lily.griman@umontana.edu, Becky at bstrief, BSTRIEFF at abilitycenter.org, and Sarah at sheldman@abilitycenter.org. And we also have a website. I was gonna drop it in the chat, but what I think the best way to do is we're still in the process of finalizing some of these materials. So what I really would encourage you to reach out to me. So it's LILLIE.GREIMAN@umontana.edu, and I would be more than happy to share all of the resources on this project, and keep your eyes peeled for stuff coming as we start to disseminate this information through April, our partners at April and Nickel and our other CILs. So we do have some questions that I really want to get to. I want to revisit Kathy Baker's question about CIL interaction and emphasize that as part of this research project, all of the centers, particularly this last kind of cohort of 4 centers on phase 2, have all worked really closely together. We were able before the pandemic to bring everyone together in a group training in Kansas. So everyone met each other, and then we met weekly to talk about the process of not only conducting surveys and with consumers and doing that research, but also engaging with consumers throughout the project. So sharing ideas around solutions and strategies to help folks address their home usability needs. So it was a really close knit group, and we worked really closely together with our CIL partners, both in Disability Link and Accessibility and Voices for Independence. There is another question in here that I was hoping maybe Sarah, you could address. I think that we had from Susie Malloy. How do you picture assessing the housing needs of people with environmental sensitivities? And I think this is a super important question. And the one thing I would just say is that it's important that it be super consumer driven, right? So it's really about asking what are an individual's needs. And that's, I'm gonna turn it, actually, Sarah, I saw you turn your video on. I don't want to steal your thunder.
Yeah, I would just echo where Lily started by saying it starts with the consumer, right? So those sensitivities are very unique to the individual. So getting a really good snapshot of who that individual is and what the sensitivities are, and then starting from there. So when I think about assistive technology, it's not picking something up off the shelf and finding the person that fits it. It's the other way around. So there's some models out there for assistive technology. The one is the human activity assistive technology, or HAAT, H-A-A-T model. You might want to look that up a little bit and find some research there, but really just looking at the individual, what their needs are, and then finding the correct product or assistive technology or device that would help them. I saw another question as well, just lost it, from Mitch. Does your SIL pay the carpenters or do they work voluntarily? So we are really fortunate. I know that we are a very unique center. We have over 50 staff, and we actually have 3 carpenters on our staff here at our center. And then Susie put some great things, going back to the sensitivity, she put some great things in the chat. She said, do not glue down new carpet, do not repaint units between tenants, or we can never use the apartment. Don't install smart utilities. We will pull weeds, so do not need to use a herbicide. We need someone who has a real job to explain us to the potential apartment managers. It would save them a few dollars, a few bucks. So those are all really great points as well. Just gonna scan in the Q&A here.
Just as a reminder, you can also raise your hand if you have a question or comment you'd like to voice as well. And you can find that raise hand in the menu bar or by pressing *9.
Perfect. It says there was some interaction among the other centers in regards to the survey process, ? So I believe Lily covered that a bit. Just to expand upon that, we were very fortunate as centers to be able to meet weekly or every other week. We had a Zoom meeting together where we could brainstorm through what we were working with consumers. We also had a Slack channel set up where we could quickly message each other. And then Lily and Kelsey, who are the other researcher on this project, we would meet with them individually as a center, just to kind of go through anything that we were facing and come up with solutions together. So it was a very collaborative feeling with the other centers involved in the research project. Susie said, the measures with which you help those of us with mobility are first rate, and thank you. So thank you, Susie, for that feedback. And go ahead, Lily, I saw you were popping on.
Yeah, thank you so much, Sarah. And I do want to address just a little bit too about the challenges around all of these programs. As Susie was talking about this renting versus owning, right? So if you are a homeowner, you can make all of the changes that you need without that same, like, particularly if you're someone with environmental sensitivities. And that is, of course, much more challenging if you have less control as a renter. This program has been really beneficial for a lot of folks who are renters because many of the items that were purchased were not necessarily items that required a modification or a change to the unit. But I think that's really where, yeah, there's some advocacy around working with and developing these community relationships with property managers and with housing authorities and all of those to really advocate around environmental sensitivities and identifying what are those key issues maybe that are across individuals. But that is, I imagine, incredibly challenging. I want to open it up. Yeah, we have Susie. Thanks again for sharing that there are maybe 10 access measures common to all people with hypersensitivities. And that is something that I think, again, there's a really rich opportunity to do some advocacy there, which I imagine can also be really challenging, however, as well. I wanted to also emphasize that we were able to work with Nickel also as part of this project to conduct a survey, and I think we'll try to get some of the results out, or maybe we can post a link to those around the different types of housing modification programs that centers do across the country. And what the Ability Center does has kind of emerged as maybe a best practice, like finding a strategy to employ contractors and handyman on staff handyman on staff rather than contracting out to a contractor. And then you have that ability to keep someone. I know that's probably not a feasible option for everyone, but definitely something worth exploring. I also really wanted to voice the Home Usability website link for folks, so you can access all of the materials. I think, again, we're still in the process of kind of updating some of the resource links and all of those things, but it's there, and I would love for folks to check it out. It's www.usablehome.com, and usable is USEABLEHOME.com. So please check out that website. We're really sad that this project is coming to an end, but we're also really excited to share all of the amazing success stories that we've been hearing, and strategies for, maybe even stopgap funding. 350 isn't gonna provide an entire bathroom remodel, but it will help support people with their needs now, while working with some of these larger programs that can help make some of those bigger changes. So that's really been the focus of this project.
And I just want to let everybody know, we did drop that onto the conference website for this session.
Oh,
so
great.
You can follow it right from that link.
Yeah. Yeah, do we have any other questions or thoughts or comments about the program? Or, it's been really fun. I honestly am so sad that we are in our last year of this project. It's been great. And so I want to reiterate again that we have quite a few research projects going on through the Research and Training Center in rural communities, and you can find those on our vendor booths. We try to be really collaborative in all of them and working with partners. I don't know if anyone was at the rural fostering rural connections presentation on Wednesday, but that's another project that we've been doing where we've been working with CILs and bringing folks together to engage in this kind of research. And it's really, really fun. It's fun to be part of these projects. So I highly encourage everyone to check out what's going on now. But sadly, we don't have any more housing projects right now. So now would also maybe be the time to reach out. I would love to hear thoughts on potential housing projects, on what are those needs, what are the research needs that we can start to pursue in the future for future grants. Housing is really hard. It's a systemic and feels like an intractable issue when you have inaccessible buildings and an out of control housing market. But there is work that can be done. And I really think this project is an example of a strategy that can really help people and has proved to be effective. So I don't know, Sarah, Becky, do you have any other last comments? I think we have about 4 minutes.
I would just encourage other centers. One of the parts of the home usability plan was going through the AARP's Home Fit Guide, and I'm sure that's on the link, the Use Able Home link that Lily shared, but it's a really great guide when when folks are feeling a little bit overwhelmed by their spaces and they're trying to figure out how to make it a bit more usable, that home fit guide was a really great launching point for us to start looking room by room and prioritizing what needed to be accomplished first. And again, it's very consumer centered, consumer driven. For some folks, being able to hang up their laundry was the top priority. For others, it was being able to sit at their kitchen table or chop food or sit on their toilet. So really just keeping the center obviously at the focus of everything that we do, and not becoming overwhelmed, but being able to prioritize using that guide was really helpful.
Okay, this is Kim Gibson again. We're down to the last basically minute and 30 seconds. I just want to remind everyone to fill out their evaluation forms and thank this group for such a wonderful presentation. It's been a joy to be part of the project, and really it's a wonderful thing that we've learned some different skills from that because of it. So you should check it out. That's my plug for it. But yes, thank you guys all for that, and make sure you do your evaluations.
Yeah, thanks everyone. Yeah, Kim, it's been great. We've been working with Disability Link for a long time on this, so it's been really wonderful to be able to keep working and building these relationships. So yes, thank everyone for participating, and yeah, please reach out. I love getting questions and hearing from folks.
Thank you. Y'all all have a good day. Please join us for our next sessions, and we will see everybody soon. Thank you for the interpreters and CART and all the presenters and Kim for moderating. You'll have a good 30-minute break, and we'll see you back in a minute.